It is now late September, and North Carolina is in the peak of the second wave of the H1N1 pandemic. Our surveillance systems, including monitoring of emergency department visits and physician visits and outpatient settings in our Sentinel provider network, have shown a marked uptick in disease activity. Currently, 6 to 7% of those visits in both emergency departments and our Sentinel provider network are for influenza-like illness. That is the kind of rate that we normally see in North Carolina during our regular wintertime flu season in February and March. So to see that kind of flu activity in September in North Carolina is indeed unusual. This, however, is typical of a second wave of a pandemic. We knew that H1N1 was circulating at low levels all summer long, and it only took schools to come back into session in early September to see disease again reemerge at such high levels. In fact, we're typical of the Southeast United States, and all of the Southeast is leading the edge of the second wave of the pandemic as schools and colleges were called back into session in mid to late August. Currently, we're also seeing hospitalizations for H1N1, but they do not appear to be increasing. Our current reports on confirmed cases of hospitalized North Carolinians is about 250. However, if you look at our emergency department system, about 300 to 400 people per week are admitted through the emergency department following an influenza-like illness at its presentation. This latter estimate, however, may overestimate the number of people being hospitalized because it is a sensitive definition for influenza, and it may overcount in that many of these people may be presenting with other diseases that affect the respiratory system and also have fever along with it. In terms of deaths, we are now up to 11 confirmed deaths in North Carolina from H1N1. All but one of these patients had underlying disease that would have predicted a poor outcome. The one person without an underlying condition, age 55 years old, is the only person so far in North Carolina that we know of that has died of H1N1 without an underlying condition. Additionally, today we'll be reporting our first pediatric death due to influenza. This child, although the details are still not quite clear, had influenza, but we are still confirming it as H1N1, and we should know the results of that within the next day or two. But also, similar to our other deaths in North Carolina, this child had severe underlying illness and was predicted to have a poor outcome with this disease. So disease activity is high, much higher than we normally see it in September, but as high as we normally see in the winter months. But disease severity is low. Although people are coming into the hospital, most are not being admitted, and those that are being admitted usually have short hospital stays, and the deaths that we're seeing are still very, very small in number.